We are pleased to present our new publication from the study INTERCOVID-2022 on maternal vaccination effectiveness against COVID-19 in preventing adverse neonatal outcomes with Omicron as the variant of concern. In 2022, we reported in the American Journal of Obstetrics and Gynecology the results of the first phase of the INTERCOVID multinational study, which showed that neonates born to women with COVID-19 between March 2, 2020 and March 18, 2021, when the original variant was predominant, were at increased risk of neonatal complications. Moreover, neonates of infected women delivered by cesarean section were more likely to become infected than those born vaginally. We then conducted the second phase of the study, INTERCOVID-2022. This was a large prospective observational study carried out in 40 hospitals across 18 countries from November 27, 2021, the day after the World Health Organization declared Omicron the variant of concern, to June 30, 2022, to assess the effect of COVID-19 in pregnancy on maternal and neonatal outcomes, as well as vaccine effectiveness. Women diagnosed with laboratory-confirmed COVID-19 in pregnancy were compared with two non-diagnosed unmatched women recruited concomitantly and consecutively in pregnancy or delivery. Mother-newborn dyads were followed until hospital discharge. The primary outcomes were a neonatal positive test for COVID-19, severe neonatal morbidity index, severe perinatal morbidity and mortality index, preterm birth, neonatal death, referral to neonatal intensive care unit, and diseases during the neonatal period. Vaccination effectiveness was estimated adjusted by maternal risk profile. A total of 4,707 neonates were enrolled, with 1,577 neonates born to mothers diagnosed with COVID-19 and 3,130 neonates born to undiagnosed mothers. Of the neonates born to diagnosed mothers, 40.7% were born to unvaccinated mothers, 9.3% born to partially vaccinated mothers, 34.9% born to completely vaccinated mothers, and 15% born to completely vaccinated mothers with booster. The main findings of the study were that neonates of booster vaccinated mothers had less than half the risk of being diagnosed with COVID-19 compared to those of unvaccinated mothers. They also had the lowest rates of preterm birth, medically indicated preterm birth, respiratory disease syndrome, and number of days in NICU. Vaccination status did not increase risk of congenital malformation in neonates. All vaccines provided protection against neonatal test positivity for COVID-19, but vaccine effectiveness was highest in newborns of booster vaccinated mothers. Vaccines were fairly effective in protecting neonates when given to pregnant women 100 days or 14 weeks or less before birth. Thereafter, the risk increased and was much higher to 200 days or 29 weeks. Importantly, none of the neonatal practices studied, including skin-to-skin contact and direct breastfeeding, increased the risk of infecting neonates with COVID-19. What this study adds is that at a time when Omicron was the variant of concern, neonates of unvaccinated mothers died twice as frequently as those of vaccinated mothers. Vaccines protected against preterm birth and adverse neonatal outcomes. To ensure that newborns are maximally protected against COVID-19, women should receive a vaccine or booster dose no more than 14 weeks before the expected date of delivery. Infants of diagnosed mothers who were being directly breastfed or kept in skin-to-skin contact were not at an increased risk of infection, which should influence policymaking for postnatal care. For further details of this and further studies, please visit our website at www.intergrowth21.com. Thank you.